further ado, I'll formally introduce Karen, and then our second speaker will be Kirsten later on. Both, in fact, have been involved with the Innovation Centre. Karen was on the board a number of years ago. Professor Karen Woolley is the CEO of ProScribe Medical Communication, and she'll discuss the business of healthcare innovation. Karen will outline where she sees the greatest opportunity for innovation in the sector, drawing from her experience in building a global health business and background in medical research. Please make welcome Dr. Karen Woolley.
And thank you, everybody. It's going to be a good afternoon. I just said to Kirsten when Mark said I'm going to identify where the biggest areas are, that I hope she agrees with me. That I think we've got educators, we've got recruitment consultants, we've got government, we've got university, TAFE. In this room, I think we've got a really dynamic group of people. I'm going to share a little bit about my story and also where I think the international healthcare trends are. And then Kirsten's going to give a very practical and detailed look at an example of a startup. So, first of all, the disclosures, financial and non-financial. Non-financial is probably more important. I've got a vested interest in doing what I can to promote and support innovative businesses in the healthcare sector. In the financial side, I do need to disclose the Director of ProScribe Medical Communications, also Director of an international board which services many of the international healthcare companies, a Director of the Sunshine Coast Hospital and Health Service, which is obviously very topical. I won't be speaking on behalf of that today. An adjunct professor position at University of Sunshine Coast and UQ, and Mark referred to my past directorship at the Innovation Centre, and also at Australia's oldest and largest organisation for therapeutic professionals. So that's my disclosures. I'm going to spend a bit of time talking about a company I know well. It started 14 years ago. It is based in Noosa, but we have offices in Shanghai, Tokyo, Melbourne, Adelaide, Brisbane, Sydney, soon to be in Seoul. So what's unique about ProScribe is it's, I think, one of the only medical communication companies in the world with global headquarters in Noosa, and that's because I'm a surfer as well, so there had to be a reason that I came there. I'm going to also give some insight, but not spend a lot of time, about innovation in terms of new medicine development. And when people think about innovation in healthcare, they're often thinking about new medicines and new medical devices. I've been involved with a couple of companies that have a Sunshine Coast link, Pepland Biotech and Phoenix Eagle. Phoenix Eagle has been associated with the Innovation Centre as well. So a snapshot of what is perhaps the most rewarding in terms of what you can do for patients with unmet medical needs, but also the most challenging in terms of the money that you need and the time you need. So then I'm going to spread the footprint out a little bit and just give you some insights into trends from the world's largest healthcare conference that brings regulators, academics, industry people together. There are some handouts for those who are interested in that and interested in the environment. I didn't print one for everybody, but I can certainly tell you where to seek out those trends. So to share a little bit about ProScribe, I'm going to highlight 5 innovative factors about our business, and I really want you to think about which of those factors might be applicable to you if you're not developing necessarily a new medicine, but you're in a service sector, and I think that's where most of the opportunity is probably going to be for the Sunshine Coast healthcare sector. So we're a service company. We're Australia's first medical writing specialist company, started 14 years ago, and actually I was overseas, flew back into a conference into Brisbane. I was on maternity leave. I was asked by the company, please go to this conference. I did. At 2 a.m. in the morning, I was supposed to get some medical writing that had been outsourced to London. It was an absolute shock. I had to stay up the whole day so I could go out that morning. And I thought, why are we spending so much money as a company outsourcing it across the waves when I can do a better job? So that's how it was born at 2 a.m. In a hotel room. And when you say innovation, you have to have a little bit of risk, but it comes with reward. And at that same time, I just turned down the head of clinical research at $500,000 per annum, and I just turned 30. So you have that money side, or do you want to do something different? And obviously for lifestyle and other reasons, you can say no to that package and still be way better off pursuing what you like. So service can be in the healthcare sector. You don't have to make a pill. You can be in the service sector, and you've got to find something where you can do something better than what's happening overseas. I really fundamentally believe if you go into the service sector, you've got to be as good as what anybody can get around the world. To do that, you have to get a niche. You really have to specialise in something and be the best in the world at it. We also have innovation in terms of our staff, so we're the only company in the world that requires all of our medical writers to be MD or PhD qualified. We're also the first in the Asia-Pac region to have our writers undergo international certification, so going to an international testing centre exam. All of that costs money, but again, you've got to invest in the right people because that's what a service business is. And back then, people sort of went, oh, how could you only hire MD PhDs? But we could see that medical communications was going to get more and more scientific, and the qualifications and calibre of the staff was a differentiating factor for us. In terms of our structure, and it's not innovative now, but 14 years ago when we said we were setting up the global headquarters in Noosa, we were pretty much laughed out of town. I still remember one of the Noosa councillors coming to visit and sort of saying, you must be so proud to tell people that you're based in Noosa. And I just went, we just don't tell anybody we're based in Noosa. And he couldn't really see, but you're Noosa. And it's like, I love Noosa, but if people at that time, 14 years ago, they would just think you were goofing off. Now, there was a bit of goofing off happening, but we still ran a very professional company. So the structure was all virtual. So everything, all of our systems, our processes, our company culture had to be set up with a virtual company in mind. What that means is when the company's sold, there's very little downtime. You don't have to worry about moving staff every which way. It's a very seldom feature to our company, and everyone is quite used to working in that virtual environment. And it really forces you to have this whole element of trust. We don't monitor our medical writers. They can be anywhere in the world. They are anywhere in the world. It's all based on the output that they give, and it's a really neat company culture, I have to say. In terms of strategy, 14 years ago, in the healthcare sector, everything was the European market or the US market. Japan was in there a smidge. Our whole strategy was that we would be internationally recognised, which meant we had to do something in our company, I'll tell you that in a minute, that really put us on an international stage, so that we never have advertised our services. We haven't spent money on advertising. Sorry if anyone's in the advertising sector. But our staff have been regularly invited as guest speakers at international conferences. I think we're the only company in the world that's been invited, for example, by a conference that's only held every 4 years by the editors of the American Medical Association Journal and the British Medical Journal, a really prestigious conference, and we're the only group in the world that's been invited back since 2005. So our strategy was internationally recognised. That was one prong. The second prong was to establish a track record of compliant, trustworthy results in the Asia-Pac region. And no one wanted to touch Asia-Pac. There's corruption, bribery, you see that in the paper. They didn't know what medical writing was. Doctor in China earns 13 grand a year. How are they ever going to afford medical writing services, etc., etc. So we knew all of that, but we also knew that to be successful in the Asia-Pac region, you had to have relationship build and you had to have results. Now, for us, surprisingly, our first trip to China, and they said it would never happen, we walked away with some very sizable contracts before we left the country. That's an anomaly, but long term that has actually proven of great value to our business, and that's why people are looking at buying it. And that affects our branding. So we've got a very strong focus on ethical and effective medical communications, and we're positioned right in the Asia-Pac region. So even though we do work for the US and Europe, our focus and our selling point is you can trust us in the Asia-Pac region. Now, in terms of sales, I said we've never advertised. What we do have is a bunch of nerdy scientists that like to write. And so we have to keep them intellectually engaged. It's not about just paying them. We pay them equivalent to US and European salaries. And yet we're competing in a market where people earn probably 1/10 of what our writers will. So we've got to have something special going for us. And because we're nerdy scientists, we do a lot of research and development on our industry. And so we will present that overseas. So, we've done the first study, which ended up being the most downloaded article from a leading medical journal. Every 2 years we do a major research study. So it costs money, we put that in, then we present the results overseas, and you can imagine what's that doing to the brand, particularly when people are really looking for people who understand the sector. And the same way you do research to advance a profession, we're doing research in medical writing to advance it. So some of our research is now cited and has changed practices. So all those little innovative pillars of our business have really helped. And when you look at a service business, I hope that you can take some of that. It's not just inventing a pill for the healthcare sector, it's what am I doing in terms of other elements that are fundamental to any business that really is innovative.